Hi, my name is Victoria Garcia, and I'm going to be performing part 3 of my IV checkoff. As you can see, I've changed my board to fit to my IV piggyback. I'm going to go ahead and get started now. So the first thing I'm going to do is I have my mini bag here. I'm going to compare it with the MAR. So it is the right medication. I'm checking the expiration dates. I'm checking the solution. It looks good. The expiration date right here. There's no damage to the bag either, so that's good. And I'm going to put a timestamp on it so when this needs to be changed. So I'm going to put the timestamp on. And now what I'm going to do is I'm going to identify my patient using these two patient identifiers. Can you please give me your full name and your date of birth also? Thank you so much. That does match with my MAR. So now I'm going to wash my hands. I'm going to perform hand hygiene. And I'm going to don some gloves, which I have right here. I have all my equipment in front of me. Okay, so now what I'm going to do is I'm going to insert the spike of the tubing into the mini bag. So I'm going to take off the cap and I'm going to insert it into the mini bag like as so. So now that I've done that, and now I'm going to attach the end of the tubing of the mini bag, and I'm going to insert it into the injection port. So the first thing I'm going to do is I'm going to clean it. I'm going to take off the cap, and I'm going to insert it into the port of the main tubing, the one that's farthest away from the patient of the tubing. So now I need to make sure that my primary IV line is below my mini bag. As you can see here, I put the primary line right here and that above. Okay, so now I'm just going to be using my board. Okay, so now what I'm going to do is I'm going to open up the regulator clamp, and I'm going to set the IV rate to what the doctor ordered. After the medication has been infused, I'm going to check to make sure that there's no occlusion into the tubing. The flow rate looks good, and in the primary infusion, it's going in good. It doesn't look to be like there's any infiltration to the side either. So then I'm done with the IV piggyback. So now I'm going to take these off, and I'm going to wash my hands and perform hand hygiene, and I'm going to go ahead and I'm going to clean up. Okay. So now that I've done that, I'm going to go ahead and I'm going to move on to removing or discontinuing the peripheral IV access. So I'm going to explain the procedure to the patient, and I'm going to make sure to educate them to remain extremely still. So we're going to be taking out your peripheral IV access device today. I'm going to need you to remain extremely still during the procedure. Do you understand me? Awesome. Thank you so much. So the patient does understand. So now I'm going to close the clamp, turn the IV regulator off, and I'm going to don gloves, which I have right here. Okay. Now, while stabilizing the catheter, I'm going to remove the dressing. I had to use a lot of tape to secure it. It was getting stuck on his fur. Okay. So now that I've done that, I'm going to hold some sterile gauze above the puncture site. And I am going to very gently withdraw the catheter, and I'm going to make sure that the hub is parallel to the skin. So please remain extremely still while I do this. Okay. And now I'm going to apply pressure to the site for at least 2 to 3 minutes. And I'm going to secure it with tape. There you go. Okay. I'm going to inspect the catheter to make sure that none of it has been broken off. It looks good. None of it seems to be broken off. It looks to be all intact. And I'm going to dispose of this correctly in the sharps container. The sharps container is behind me. I'm going to instruct the patient to alert us if he notes any redness, any swelling, if there's any drainage coming from the wound, or if there's any pain. So please alert us, and I'm going to discard of all of my equipment. So I'm going to make sure that all of this is discarded properly. And I'm going to take off my gloves. I'm going to perform hand hygiene, and I'm going to put where's my call bell? My call bell closest to the patient. Put the bed in the lowest position, and alert them have them alert us if they feel any pain. And that's it. I'm done with my IV checkoff. Thank you so much for watching.